Well, I come from a unique perspective as far as back pain. I'm a doctor of chiropractic here in Nashville, but at the same time, I'm also a back pain patient. I injured my spine playing football in college, which led me to my chiropractic profession, but at the same time, it didn't correct the injury. So eventually, that injury required surgery. And as a practicing chiropractor, our job is often to keep people away from the surgeons, but when it's necessary, it's necessary. So the time came for me to have my surgery. I consulted with 4 different surgeons, and Dr. McCord was by far the most confident and competent of those surgeons. His prognosis for me was so much better than what the other surgeons were, and the confidence he had in his work put me at ease because I was extremely nervous. I was told I may never go back to work, but not by Dr. McCord. He actually told me he'd have me back to work in 3 weeks, and actually I was back to work in 2.5 weeks. So in addition to that, I've referred him numerous patients that have seen me for back pain. Their problems were beyond the scope of chiropractic and required surgery. Each of them have had wonderful outcomes. He's our guy when it comes to back pain. As a doctor of chiropractic, our whole history, we've always x-rayed our patients in a standing, weight-bearing position. It makes sense. Patients often hurt more when they're standing. You get a better visual look at the posture of that patient as well. So when Dr. McCord purchased the upright MRI and explained that technology to me, it only made sense. If we're taking x-rays while the patient's standing, why would we not also do that with the MRI? That's the key to really getting the accurate diagnosis of the patient.